Well, to give a little background real quick, the Oklahoma State Department of Health, we are the ones that we are responsible for the surveillance and investigation of infectious diseases for the state of Oklahoma. And so when an individual experiences illness and they happen to go and seek care from their physician might decide to conduct some laboratory testing to confirm what the cause might be. If eColi is identified, specifically Shiga toxin-producing eColi, that is what's reported to the State Health Department for investigation by us. Our public health laboratory can also perform additional testing where we can determine if various cases of eColi, if they might be due to a similar serogroup and specific strain based on DNA fingerprinting. So that's how we were able to determine that we had 3 individuals in Oklahoma, plus a couple of other individuals, one in North Dakota and one in Kansas, that had a similar strain, recently within a relatively short period of time. Which prompted an investigation to determine, is this a cluster of illnesses that might be related to a common source. From interviews that are conducted, it was determined that the 3 individuals in Oklahoma and the individuals in other states had dined at a common establishment, which references Chipotle, which is then used to kind of further our investigation to try to determine, could we possibly link it to a specific ingredient to maybe determine the source of illness. And so your question is, kind of coming back to how are we able to identify a specific source, or if we can. One of the issues with clusters of illness when we have a relatively low number of cases, we're talking about 3 cases in Oklahoma and a couple others in another state, is that when you're dealing with low numbers of cases, it can be challenging statistically to really implicate one ingredient versus other ingredients, especially when you're dealing with an establishment that might have a menu that includes ingredients that are very common among multiple dishes. And so if you have individuals that consume various dishes that include common ingredients, especially like produce items like cilantro and red onion and lettuce and tomato, it can be very difficult to really tease out specifically which might be more likely as a source versus others. Even statistically, when we try to interview the individuals that are sick and individuals that are not sick as a comparison group. And that's one of the challenges that we have at the stage of this investigation, is that with a relatively few number of cases and based on the foods that were reported to be consumed at a common establishment, even within that, the commonality of those ingredients across multiple dishes kind of makes it difficult to really tease out one over another to kind of further the investigation along. Well, there's a couple of efforts that we utilize. One is epidemiologic studies, where we try to utilize information reported by persons that are ill and make that a comparison to persons that were not ill to see, are there differences among specific foods that were consumed from a common exposure, such as at the same establishment. That's one method. But again, even with few numbers of cases, it can be very difficult statistically to try to even tease out a difference of specific ingredients. Other methods that are utilized is sampling of food items to see maybe if by chance we might be able to identify the pathogen that's under investigation from foods that might still be in circulation. And then also working with our other state and federal partners, especially our federal partners, on looking at the suppliers of specific foods and see how they might link the Oklahoma establishments to maybe establishments in other states that have had cases, both in our relatively smaller cluster, the one with 5 cases, as well as the larger cluster that occurred back in October that involved 53 cases, if I remember correctly, and 9 other states. So utilizing information where our federal partners at the Centers for Disease Control and Prevention and the Food and Drug Administration to have them take on their role of evaluating that information on food supplies to see if maybe there's something that can kind of tie in together that might help narrow down, which can also be a challenge if we're talking about chain establishments that kind of use common suppliers. So that's kind of where the investigation is there are several things in progress in regards to information that's been collected in regards to suppliers and the evaluation with our federal partners that are ongoing, and our attempts with interviews to see if there might be something there that could really kind of be unique or teased out, which at this time has been very challenging with the relatively few number of cases we have. Well, if the epidemiologic investigation is able to identify a specific ingredient, one of the foods, that really does seem to be likely tied to occurrence of illness, then information in regards to where that food came from is then tracked back. It's called a traceback investigation, where You follow the records from the restaurant back through their suppliers, back to the original source, which would be the farm. You know, when we're talking about produce items or even meat items, we're talking about where it came from. And then, so the officials that regulate those sources would then go back to that site and they would evaluate the conditions, the harvesting, the production, the growing, and try to identify any kind of problems that may have occurred recently with the foods that were produced at that facility. And from those findings, they could then utilize that to recommend and implement specific preventive measures to try to prevent a similar outbreak from happening again. So if there's non-potable water that might have been used accidentally, or poor harvesting practices that would have led to contamination somehow down the line, then an intervention would be put into place to try to correct those issues to try to prevent from similar outbreaks from happening. I mean, really, when we're talking about the foods that we eat, it's a global supply. There are some foods, depending on the ingredients, that are going to be harvested and they come from the United States, various states that are good at producing those foods. Some, based on the seasonality or just the fact that they don't originate from the U.S., might be coming from other countries, such as Mexico, Guatemala, Europe. You know, our food just comes from all over. And so in that case, if we were to identify a specific ingredient that may be traced back to another country, then our federal officials would then work with their international partners of that country, the Ministry of Health and the agricultural officials that might be involved in regulation of that production source of that farm, to conduct their investigation to identify exactly what happened.